Hi, it's Dr. Lane Smith at the Smith Plastic Surgery Institute here in Las Vegas, Nevada. Today we're going to talk to you about rhinoplasty. Again, this is a frequent video and subject of mine because this is the most common or second most common cosmetic surgery procedure in the United States, depending on who you believe, but it's certainly one of the very most common procedures in the United States, so there's a lot of interest in this. I do this surgery a lot, so I post a lot of videos on rhinoplasty, and today we've got a very large bump with a very large bulbous tip, and we're going to show you how we correct that.
Welcome to the Smith Plastic Surgery YouTube channel, where we post videos regarding plastic surgery, beauty, and skincare. We are one of the busiest plastic surgery practices in the United States. If you like what you see, please like and subscribe to our channel, or visit our website at smithsurgery.com to learn more about our practice and see more before and after pictures.
So as I mentioned, we're talking about rhinoplasty today, and as always, we're going to show you a short clip of a video of an actual rhinoplasty on a patient. If you are squeamish and you don't like to watch surgery videos, please don't watch this. Either skip this part or maybe don't watch the video, but we're going to show you about a 3 to 5 minute clip of an actual surgery that we did on a patient and the immediate transformation you can see right on the operating room table. Hi, it's Dr. Smith again from Smith Plastic Surgery. We're going to film another rhinoplasty. You can see very bulbous nose with a large bump. So now we're just making our incision. Again, you want to open this kind of like the hood of a car. We can stop. As always, at the beginning of a rhinoplasty, we're just kind of lifting the skin off the nose so that we can operate on it very precisely. So we've elevated over the nose some skin, and we made a little pocket, and we're just going to rasp it down, just kind of basically shave it down. Okay, we've peeled the nose back, and then we're going to trim these cartilages that make her have kind of a bulbous tip. Just going to trim them down a little bit right here. And this will help with that. You can stop. Okay, we've got the cartilages trimmed here, and then we're going to kind of sew the cartilages together to narrow the tip. Okay, so then we're gonna put a little piece of cartilage right here as a cartilage graft and sew it in place. We're gonna kind of give a little more projection, make the tips stick up a little more. And now we put two pieces of cartilage graft up here, one in between to give it strength. Now we're just going to close this back, down, and like we always do, and then we're going to break the bones. Okay, now we've made the tip a lot narrower. Okay, you see it's much narrower, but it's still very wide here. So we're going to cut the nasal bones, okay, with this really precise chisel. Of this, and then narrow the width of the bones, or narrow the width of the nose. Okay, and this will also help us straighten it out a little. So now we've made the tip a lot narrower and a lot narrower through here, and I'll show you. Okay, here we are after surgery, and you can see really looks a heck of a lot nicer, really cute, but not too pointed. And a nice little scoop like she wanted. Very nice little scoop. Okay, we're all done now, and you can see we've got the cast in place, we've got it taped, and you can see very little bruising. She almost got no bruising at all, even though we cut the nose bones maybe almost 20-30 minutes ago. So she's not gonna have a lot of bruising. You don't have to look like you're beat up with this surgery. If your surgeon is good, and I'm good at this, you won't look beat up and like you've been hit by a bat like you see other pictures on the internet. She's gonna look good in a week when we take this cast off, although the nose does get a little better for a year. Patients are always asking, hey, we wanna see some before and after pictures. Just get on smithsurgery.com, Smith and Surgery, one word, .com. There are tons and tons of before and after pictures. Okay, so now you've seen that surgery. You saw the patient before surgery. She had a very large bump or hump on her nose, very bulbous tip. And the transformation right on the table is already amazing. Keep in mind that even on the table, she's a little swollen already, and things are going to get better for up to a year. but even right on the table, walking out of the operating room or going out of the operating room, she already looks a lot better. After this surgery, of course, we put a cast on. We leave that on for a week. We typically take it off after a week. And usually the day we take it off, there's about a 70 to 80% improvement. It is important to know that the nose continues to improve for almost a year after surgery. And the reason for this is because when we do a rhinoplasty surgery, we go inside and we make the skeleton, typically make the skeleton a little smaller, make the tip a little smaller, make it a little straighter, things like that. But the skin of the larger nose has to shrink down onto the smaller nose. And so that takes some time. Immediately it already redrapes better right in the first week, but over a year it continues to shrink down a little, suck down a little bit, kind of like shrink wrap, and tighten up a little bit so the nose gets a little smaller and a little better for about a year. It's common to have a little bit of stuffiness after surgery for up to 3 months. The pain from a rhinoplasty is not bad. Patients come in, they're always afraid of getting a rhinoplasty because they think it's super painful. And indeed, if it's done wrong, it is. But in my hands, that is very rare. And one of the reasons is because the most painful part of a rhinoplasty is when a surgeon packs the nose. A more old-fashioned way to do a rhinoplasty is to pack the nose with nasal packing. And honestly, I don't ever pack the nose, or very rarely put in little nasal tampons that we usually remove the next day, but we're not packing the nose. And the reason we don't have to pack the nose is because if you do this surgery with a lot of finesse, if you cut the nasal bones with tiny little 2mm chisels, you don't stir up a lot of bruising, you don't stir up a lot of bleeding, and there's no need to pack the nose. Also, patients look good even a week after surgery. You don't have to look like you were hit with a baseball bat like I see on some people's before and after pictures or on some YouTube videos. You don't have to look like that. You can see our patients right on the table. On all my videos, I show you right after surgery. They've been sitting there for a half an hour, 2 hours, and yet there's almost no bruising. So, you know, most often we get very little bruising. Most often it is not very painful. Patients take 1 or 2 pain pills, and patients already look good even after 1 week, but they continue to improve for up to a year. So if you're considering rhinoplasty surgery, things to consider. 1, make sure your surgeon does a lot of them. Again, I do among the most or possibly the most in Nevada here. Number 2, make sure they can show you a lot of before and after results. We also image you. So when you come in, we're going to give you an image of what your nose will look like after surgery. We actually give you that because usually we're very close to these pictures. We're not exactly the pictures, but we're pretty close. I always like to say plus or minus 10%, a little bit worse, a little bit better, but close to the pictures we give you. And a good rhinoplasty surgeon should be able to provide you with before and after images before your surgery so you can have an idea of what you will look like. And also this helps the surgeon to know what you want. So as I'm imaging your nose, you know, I can tailor it to what you want. And I can say, hey, we can do this or can't do this. If you say, well, make this a little smaller, if I can't do it, I'll say, hey, we can. Or make this a little bigger or wider or whatever. We can do this together so I know exactly what you want. So the ability to image the rhinoplasty is important. And a good rhinoplasty surgeon should be able to image your nose prior to surgery and talk to you about it. So I hope these hints have been helpful. If you're interested in rhinoplasty, please watch some of our other rhinoplasty videos. If you have a friend who's interested in it, please share it with them. Again, if you like the video, please like, subscribe, and if you have any comments, please leave us some comments, or you can call us directly at 702-838-2455, or get on our website at smithsurgery.com to make appointments or to ask questions. We're happy to help you. I hope this video has been helpful for you. Thank you for watching.